Welcome to Alcohol and Other Drugs at Work, What Supervisors Should Know. This program will increase your awareness about alcohol and other drugs of abuse, the effect these substances have on employee productivity and health, and the adverse impact on the well-being of your entire work organization. We will be discussing the signs and symptoms of a substance abuse problem and how signs and symptoms of a drug problem can change from one type of drug to the next. We will identify and dispel some common myths and misconceptions that supervisors often have about substance abuse, and you will see photographs of commonly and not so commonly abused drugs. We will explore how to intervene with a troubled employee whose performance may be affected by a substance abuse problem. And you will learn how to avoid enabling, the primary means by which employees with alcohol and drug problems get worse. Follow the guidelines established by your organization and its drug-free workplace policy and procedures. If you have questions about material presented in this program, be sure to ask for clarification from your Employee Assistance Program, Alcohol and Drug Control Officer, Human Resource Manager, or other resource person assigned to address substance abuse problems in your organization. Enjoy the program. Personal problems are frequently symptoms of alcoholism or drug addiction. In some instances, personal problems may be unrelated to a substance abuse problem. Instead, they are just made worse. Personal problems of employees may include emotional problems, job problems, legal problems, financial problems, medical problems, marital problems, and many more. Personal problems may influence a drinking or drug use pattern, but they are not causative. Addiction stands alone. It is a primary health care problem, and personal problems, no matter how severe, don't cause it. For example, one of the most popular misconceptions is that alcoholism or drug addiction is caused by stress. The words alcoholism, drug addiction, addictive disease, and chemical dependency are often used interchangeably. Alcoholism was declared a disease in 1957 by the American Medical Association, and it was declared a disease in 1956 by the World Health Organization. Its cause results from the body's reaction to the drug or alcohol consumed. This reaction, the ability to acquire addiction, has been shown to run in families and is now believed to be genetically determined. Addiction is not learned behavior. Instead, susceptibility to addiction leads to addiction and results from normal social drinking by a person with this vulnerability. This vulnerability is believed to be inherited in most cases. The environment, culture, or psychological factors can affect drinking and drug use patterns. There are many common myths and misconceptions about drug abuse, alcohol abuse, and alcoholism. They include a belief that it's a willpower problem, it's a psychological problem, it's caused by drinking too much. Alcoholism and drug addictions are not real diseases. It's a character issue. The impact of myths about alcoholism and drug addiction are very powerful, but their end result is the same: maintaining stigma and contributing to an addict's refusal to get help. Employees with alcohol or other drug problems tend to believe the same thing about their drinking or drug use as most people, that they are struggling with willpower, stress, or other disturbing personal circumstances that cause their drinking or drug use problems. Unfortunately, until they are treated for their addiction, they do not understand the disease process that will not let them go. Addiction is a very treatable illness, and success rates for patients referred from the workplace are consistently higher than for any other group, but follow-up is key. Employees usually enter treatment with proper constructive confrontation that can easily be learned by supervisors and managers. The key is to focus on performance and making the employee responsible for change. Workplace symptoms may not appear for 15 years or more, although symptoms at home may be ongoing. Good success rates in treating employees referred by employers is directly associated with the influence and leverage afforded by the employment setting, which helps the addict feel a strong sense of urgency necessary to complete treatment. Drugs of abuse include alcohol, depressants, amphetamines and stimulants, narcotics and designer drugs, hallucinogens and inhalants. The cost of workplace drug and alcohol use is believed to be over $100 to $120 billion, according to the National Institute on Alcohol Abuse and Alcoholism. Beverage alcohol is ethanol or ethyl alcohol and is found in beverages, foods, and food preparations, and many medicinal products. Alcohol is a central nervous system depressant, although some drinkers experience a stimulant effect from it. Employees with alcohol problems use 3 times as much sick leave and have workers' compensation costs that are 5 times higher than employees without alcoholism. Alcoholism and drug addiction contribute to lower productivity, lower morale, increased insurance costs, and fringe benefits use and abuse. Alcohol is processed from sugar, which gives it high caloric levels. Alcohol is easily used as a source of fuel by the body. Therefore, it is considered a food, although it has no vitamins or minerals. These empty calories explain the poor nutritional habits of alcoholics as they pass into middle stages of the disease and eat less while they drink more. Alcohol is also a toxin or poison to the body. It may be the only food product sold that can kill you if you consume too much of it. Overdrinking at fraternity parties to the point of death by alcohol toxicity is a good example of how alcohol can kill directly by consumption. All 3 of these products, a mixed drink, a beer, and a glass of wine, contain approximately the same amount of alcohol. Some liquid cold medicines are 50 proof or 25% ethanol. Other food products may contain as much as 50% alcohol. You may have heard of alcohol-free beer. Virtually all alcohol-free beer is not alcohol-free. It's about 0.5% alcohol or 1 proof. Addiction treatment professionals consider drinking alcohol-free beer as a relapse if you are a recovering alcoholic or drug addict. 70% of the average workforce drinks beverage alcohol. This is a conservative estimate. 10% of these drinkers will acquire alcoholism at some point in their lives. This chart shows how tolerance to alcohol works. High tolerance means that a person can drink more than most people and not feel alcohol's effects, even though they are more intoxicated than they feel. On the left, a typical driver may feel intoxicated when his or her blood alcohol level rises to 0.08 and will demonstrate erratic driving. However, a person on the right with drug tolerance to alcohol may not feel intoxicated and erratic driving may not be observable until his or her blood alcohol level rises much higher. Likewise, more serious problems with alcohol's effects on the body will affect the alcoholic and the non-alcoholic drinker differently. On the left side of the chart are the corresponding behaviors of a non-alcoholic person as their blood level rises. Notice at some point death will occur, but it is below the point of the person who is alcoholic. By the way, the highest blood alcohol level in an alcoholic who lived, found in the medical literature, is 1.5% blood alcohol level, nearly 20 times legal intoxication.